This is our patient Joan, who just visited our office after completing her treatments with her dentist, Dr. Handler. So, how's it going?
It's going very well. I'm very happy with both.
So, if I remember correctly, we lost some teeth and we helped you replace those teeth. And it's kind of unusual in your situation because we used a dental implant in one area and we used a conventional bridge in the other. Is that correct?
That's correct.
So tell us about your perspective as a patient, the difference between a bridge and an implant.
Well, the implant is more like your own teeth. You can floss on either side, whereas the bridge you can't do that. And plus the fact you have to use the loop to get the floss under it, and it can be a little tricky sometimes. So I'm really happier with the implant than I am with the bridge.
And I believe your bridge is in the back and your implant is in the back. Is that correct? So these don't replace front teeth where it would be even easier.
Right.
It's harder in the back.
Yes, it is.
And you told me that the implant went in relatively a simple procedure?
Right. He didn't have to make any adjustments at all to it, whereas the bridge seemed to be a little large for the space and didn't want to fit in there very snugly. But he did make adjustments, and now it feels fine, and just like my own teeth, with the exception of inability to floss between each tooth.
What advice would you offer to patients or doctors when considering replacing missing teeth?
Well, the very first thing would be to get the patient to get to the periodontist when there is bone loss, because I think that was the reason I couldn't have the bridge on the left side as opposed to the implant on the right side.
So early treatment and early prevention.
Right.
Right. I think we both would agree on that.
Right.
And from a discomfort standpoint, did you have a lot of discomfort with the periodontal treatment or the implant treatment?
I really had none at all. I was very fortunate. I didn't even take any of the prescriptions that were given at the time of treatment. I just had no pain, and it was a little uncomfortable getting the shots to numb the area, but other than that, I really had no problem.
And we did pretty much conventional periodontal treatment with you. We didn't use lasers or anything like that. It was just regular, old-fashioned, basic gum treatment, right?
Right. That's right.
Yeah, it's good. Well, how do you feel about? I think it was Dr. Handler who referred you to me.
That's correct.
Yeah. How do you feel about dentists who work with specialists and recommend specialists to help them with the care of their patients?
I think it's very important, and I think it's good for them to have a good rapport with each other, and that seems to be the case with you and Dr. Handler, so everything just went very well. I have no complaints.
Good. Well, thank you very much for doing this video testimony, and we'll share this with patients and doctors who also have patients who are in need of services like you, and all patients make choices, and we hope you made the right choice.
I did. I just didn't make it soon enough.
Well, thank you very much.
Thank you.